And so if you're on YouTube or the podcast right now, please consider subscribing. It is my goal to serve you all to the best of my ability. Again, we're going to talk about right congestive heart failure, left congestive heart failure, where it really comes from, and then how do we get some of the signs and symptoms so we don't get confused, okay? So the first thing that you need to know when you're going through this concept here is you have to understand basic cardiac physiology. This is going to be super, super important for you, all right? And so what we have to know is, when we're looking at the lower extremities, and yes, I'm going to do my best. I'm learning how to draw, apparently. I got my drawing pencils. I'm just kidding. I don't got drawing pencils, but, I'm learning to be the next Pablo Picasso. Anywho, I'm drawing out my dude here, right? And yeah, those are some pants, and it looks like he has a chicken foot down there. But the moral of the story here is that there is going to be a system that is going to supply the heart with blood flow. And when I say the heart, I'm going to talk about the right side of the heart. So you have the system that comes up. Go ahead and name that out for me. What would you call that system? Should we call that the venous system, right? The veins are going to bring the blood flow up towards what? The right side of the heart. And so I'm going to go ahead and draw that out really quick. And yeah, some of this is going to be a little on the basic side, but I promise you it's going to help when we start to figure out what the signs and symptoms are, okay? So I'm going to have the right side of the heart here, the left side of the heart. This is actually the right ventricle that's here, and this is the left ventricle. And then above this, you got the right atrium, and then you got the right ventricle, okay? And if we want to go into the valves and all that stuff, we can go into the valves and say on the right side, there's going to be the tricuspid valve, and then on the left side, there's going to be the mitral valve. Okay, cool. So like we were saying, the blood flow is going to come from the legs and enter the right side of the heart via the inferior and superior vena cava. I know you've heard those names before. Yeah, baby. So the superior and inferior vena cava, they're really going to dump blood flow into the right atrium, right? And the right atrium is going to squeeze the blood and it's going to go into the right ventricle. Y'all follow me right now? We're all good, right? And here's the next piece where a lot of people get hung up, and I'm going to draw this yellow. All right, the people get hung up in this next area because there is a pipe that comes from the right ventricle and goes up to the lung tissue. Does anybody know what that pipe is? Please put it down in the comment box right now, whether you're on replay or not, doesn't matter. What is this yellow pipe that is going up to the lung tissue? This is going to be really important for you to really understand these signs and symptoms once we get there. You should be saying, well, that pipe is known as the pulmonary artery. Why? Because arteries take blood away from the heart. And notice how the blood is going towards the lungs now, away from the heart. We call that pulmonary artery. All right, or the pulmonary arteries. Cool. So then the blood goes into the lungs, it gets oxygenated, right? And then that blood is going to come back from the lungs towards the heart. Well, what do we call the vessels that come back to the heart? What do we call those? Veins, right? Yeah, and that's exactly what we are going to call this, pulmonary veins. Pulmonary veins bring it back. 100%. Y'all with me, right? So the pulmonary veins are going to bring it back to the left atrium. Left atrium. All right, let me put that up here. Left atrium. Good. And then the left atrium is going to squeeze the blood and it's going to go into the left ventricle. All right, here it is, y'all. Now, this is the tough part. I hope you're following me. So after it comes from the left ventricle, where's the next place it goes? You should be saying the aorta. The aorta, it's going to push the blood flow through the aorta, and now it's going to go to the rest of the body. And I know this isn't really going to be drawn physiologically, but listen, y'all, I'm doing the best I can do. All right, so we're going to say that this magenta line is now going to be called your peripheral arteries. And your peripheral arteries are going to go out to the body. All right, and then we'll just put body out here. Does that make sense? Does that process make sense? So when we look at this, we see that blood flow is going to come from the lower extremities. It's going to come up to the right side of the heart. Right side of the heart pumps it to the lungs. Lungs pumps it back and gets it back to the heart. on the left side of the heart is now going to pump it out to the body. Are we all good with the physiology here? That's important. This is step one for understanding this process. Cool. So if we're good there, I want to explain to you exactly how someone gets left heart failure. One of the major reasons why they do. Do you know? Put it down in the comment box if you already know. So let's go over one of the major reasons why someone gets left heart failure. It's typically because of something called hypertrophy, or what we call left ventricular hypertrophy. Can you tell me, how do muscles hypertrophy? How do they get bigger? How does their cross-sectional area get larger? How does that happen? Come on, y'all know this. So you go in the gym, right? You CrossFit it out. I'm not shaming anybody on CrossFit, but I wish my six-pack looked like that. But you load up the weights, right? You put on more weights, you do more weight, you strengthen it up, and then it hypertrophies, right? Okay, well, here's the deal. Left ventricular hypertrophy is not a good thing. It's not good. It's not good when your heart is very big like that, because then it can't fill up with good blood flow. My question to you is, how do I get this not good thing called left ventricular hypertrophy? How does that happen? Well, it's going to happen because the left side of the heart is now under a lot of resistance. It's a lot of weight that it's pushing out against. Right? So what do we call that extra weight? What is giving it that so much resistance? It's actually going to be these pipes right here that go out to the body. We call them peripheral arteries. And when there's vasoconstriction, which makes those pipes really small, right? So the lumen, instead of looking like this right here, the lumen starts looking very small. The diameter gets small. That's called vasoconstriction. Well, what that does is it increases the amount of resistance the heart has to push out against. So what is Kyle saying? What is Coach K saying right now? That if someone has prolonged hypertension, systemic hypertension, so I'm going to put elevated systemic blood pressure or hypertension, that's going to equal our patient having left ventricular hypertrophy. Again, if this is prolonged. Why? Because the heart is having to push out. The left side of the heart is having to push out against so much resistance. And so it hypertrophies. Does it do that after one episode of hypertension? No. It does this after somebody is sustained at a hypertensive level. Somebody who's not eating well. Somebody who has a lot of atherosclerosis in the arteries. And then what happens is the heart has to pump out harder. Does that make sense? Can I get a clear down in the comment box if that makes sense to you? Prolonged systemic blood pressure, aka systemic hypertension, creates left ventricular hypertrophy. Are we all good? Allison, I see you. Okay. So let's keep this moving. I'm going to go ahead and erase that. So now you know where left ventricular hypertrophy can come from. If a patient has left ventricular hypertrophy, what happens is the patient is not able to get in as much blood flow into that left ventricle, so it pumps out less. Well, then we start to run into a problem called heart failure, where the left side of the heart is not able to keep up with the demand, y'all. That's called left ventricular heart failure, where the left side of the heart cannot keep up with the demand. There's a lot of blood that's coming, but the left ventricle cannot keep up. Okay, now here we go. This is really important for you to understand. If someone has left ventricular heart failure and the left side is not keeping up very well, won't the blood start backing up? Think about this. Won't the blood start backing up because the left side of the heart's not pumping it out to the body, right? So it'll start backing up. So can you all do this with me as an exercise? Actively listen right now. If we're in the left ventricle and it's not working well and it's backing up, where's the next location it backs up into? You should be saying left atrium. You're right. You're right. So I'm going to use another color here. See if we can use maybe a lighter blue. All right. So the blood was originally here and it starts backing up into the left atrium. And then the left atrium's getting full of blood and it's not able to push the blood through. And so where does the blood back up now? Into the pulmonary veins. All right. And then it starts backing up more. And then guess where it backs up into, y'all? The lungs. And now what does the patient start to have? This thing called pulmonary edema. It's excessive fluid inside of the lung tissue. So now they start coughing up, like they start having what we call a pink frothy sputum. They start to have a lot of either mucus production or they could start having a productive cough. They even may say, oh, I'm very short of breath, moderate to severe short of breath. Why? Because they're backing up with blood flow into the lungs. So that's the reason why your patients with left ventricular heart failure, which then turns into left congestive heart failure. That's when there's actually a backup of blood flow. That's the reason why they now will have things like dyspnea, shortness of breath, pulmonary edema, where they're having a spasmodic cough and coughing up pink frothy sputum, they call it. Blood tinged sputum. Why? Because there's blood backup into the lung tissue. That's the reason why we have this. Is that clear? Is that making sense to everybody? We're there. All right. Now I really want to say this, that if left ventricular heart failure, if left congestive heart failure continues to get worse over time and we don't either get a heart transplant or the patient doesn't do anything about it, what will tend to happen is this blood flow will continue to back up. And it'll continue to back up and it'll start to stress the right side of the heart, creating a whole new problem, y'all. Does anybody know what that problem is going to be called? Right-sided heart failure or cor pulmonale. That's where this comes from. All right. So what are some of the signs and symptoms I get with left ventricular congestive heart failure or heart failure? I start to get pulmonary edema. I start to get moderate to severe shortness of breath. I start to get a spasmodic cough that has pink frothy sputum. I start to get a patient who has what we call proximal nocturnal dyspnea. That's where they're sleeping at night, potentially in like a supine position, and they wake up really quick coughing because they feel like they're drowning. They wake up in the middle of the night feeling short of breath. Why? Because the blood is backing up into the lungs. Those are consistent with left congestive heart failure. Cool. So that's it. All right. Now you have one, again, that's one of the major reasons why we have left ventricular hypertrophy is the systemic hypertension. That's what we mentioned. And those are some of the major signs and symptoms that we have. All right. Cool. Can I write those out? Of course I can. You ready for me? Here it is. Let's write some of those signs and symptoms out. Signs and symptoms. Definitely for the MPTE, we need to know these ones right here. One is going to be mod to severe dyspnea, aka shortness of breath. All right. Another one for you is going to be, I mentioned this before, proximal, nocturnal, I can't even spell today, y'all. Nocturnal dyspnea. All right, so another type of shortness of breath that we find at night, typically. Another one can be a spasmodic cough. Another one is pink frothy sputum. Pink frothy sputum. All right. Now, there's a few other ones. Of course, the person's going to have activity intolerance, where they're not going to be able to participate in as many activities that they normally do, or exercise intolerance. Why? Because they're not pumping out good oxygenated blood. They're not getting it out to the muscles that need it. And so the patient starts to present with weakness, fatigue, exercise intolerance. So those all come along with this as well. All right. Exercise intolerance. Okay, so those are some of the major signs and symptoms that come. Right now, what I want to do is I want to talk about the right side of the heart now that y'all have seen the left side. Is that cool? So what we want to do now is we want to talk about, well, how do I get right-sided heart failure? How do I do that? Okay, and so what I want to do really quick is let me just erase this side of it. All right, that way we don't get confused. I'm going to erase all that. Okay, so let's talk about the right side of the heart. How do I get right ventricular hypertrophy? Right ventricular hypertrophy. How do I get that? All right, so I told you how the left gets it. What? Remember, it was having to push against so much resistance. Some of y'all are already starting to think like, oh, okay, so systemic hypertension, or high blood pressure is it? No. The right side of the heart is not going to hypertrophy because of systemic hypertension. Why? Because the right side of the heart doesn't push out against the peripheral arteries. It doesn't push out against systemic hypertension. It pushes into these. It pushes out into the pulmonary, not peripheral arteries, pulmonary arteries. So can you all tell me what is going to make the right ventricle hypertrophy? Come on, just look at this pipe right here. What is that called? The pulmonary arteries, yes. But if I increase the pressure in there, what is that called? Increased pulmonary artery pressure. Have y'all ever heard of PAP before? Pulmonary artery pressure? Yeah. That's also called pulmonary hypertension, y'all. Pulmonary hypertension. So let me put that down. Pulmonary hypertension. So what happens is this. I have a patient who has prolonged pulmonary hypertension, meaning that these arteries right here, the pulmonary arteries, get really small. That means that the right side of the heart has to push out against that extra resistance. That creates right ventricular hypertrophy. That's it. Marie says pulmonary edema or pulmonary congestion. Yes, that can also cause the right side of the heart to hypertrophy. Why? It has to push out against that resistance. And then when we have a right ventricular hypertrophy, that's now going to cause, if it goes on for too long, right heart failure. Is that making sense? Can I get a clear down in the comment box if y'all are following me right now? We all good? Entertaining? Is this entertaining? Because we about to end this right now. We about to lock into this last piece. Okay, so if all that is making sense, all I need you to do is start to think about what happens when the blood starts backing up. All right? The blood starts backing up, let's say starting at the right ventricle. Can y'all follow me? So if the blood backs up from the right ventricle, where's the next place that it's going to back up into? Where's the next place it's going to back up into? You should be saying backing up into the right atrium. Yeah. All right. And then after the right atrium, where's the next place it's going to back up into? You should be saying superior vena cava. The veins, right? And then it backs up into the vein system. So then my patient starts to present with this thing called ascites. Has anybody ever heard of ascites? Abdominal bloating because of fluid retention? Yeah, their abdominal region starts to blow up. Why? Because there's fluid backing up into it from the right side of the heart though. And then if it isn't corrected, what starts to happen is the fluid continues to back up. Right? And then it backs up into the lower extremities now. All right. And now the blood is in the lower extremities, and we call that backup of blood flow there the edema. The edema starts to seep out and get into the tissue spaces in the lower extremities, and we call that dependent, aka pitting edema. And so one of the major signs and symptoms of someone who is having right congestive heart failure is dependent, aka pitting edema. Their legs start to swell up. Another one is venous distension, where the veins start to balloon out. Why? Because they're taking on all of this blood flow now. So dependent, pitting edema. Another one. Can anybody get venous distension? I love it. So you may see this somewhere as jugular vein distension. Yeah, because the jugular veins are filling up with all this blood flow because it's backing up into them. So venous distension. Cool. There's one term that I learned in cardiopulm class. It was actually anatomy, but we were going through cardiopulm stuff, and we were talking about the whole deoxygenated blood flow and how there's not really deoxygenated blood. There's not blood that has like no oxygen ever, but the blood does appear bluish in color. So what is a sign and symptom of right-sided heart failure, congestive heart failure? The backup of deoxygenated, quote unquote, blood flow. So now we start to get this thing called cyanosis into the extremities. Why? We're backing up deoxygenated blood flow. So I'm going to go ahead and put that one down here, cyanosis. Are y'all seeing me? Is this all making sense? And then another one that we see that you need to know for the NPTE is weight gain. And why is that? Because of water retention. That's it. AL says digital clubbing. A lot of things that really happen because of the lack of oxygen flow to tissues. All right. So I have 4 things. Let me, I think I can move my picture out the way. I don't want y'all to not be able to see. Jeez. Let me see if I can move it. Yeah, I think I can move over there. Cool. So y'all see everything that's written down here: dependent pitting edema, venous distension, cyanosis, weight gain, water retention, digital clubbing is another one. There's a few other ones as well. Again, exercise intolerance or activity intolerance you can get with this one. But these are a lot of the major ones that the patient starts to experience is what I have written down here. Okay, so there you go. Now, one major distinction I need to make, just so you understand this for your practice exams and later on the NPTE, is this patient it's not going to get one side having dependent pitting edema. It's going to be bilateral. So if you have a person with right-sided congestive heart failure, it creates bilateral symptoms, bilateral pitting edema, not unilateral. So that's a way we can start to differentiate something like a lymphedema versus right congestive heart failure. Does that make sense? Because lymphedema, you tend to get it in one particular extremity that's affected. Congestive heart failure, right-sided anyway, will back up into both extremities. Bilateral. It's a big difference between the two. Money, money, money. All right. So for those of you who are tuning in right now, we just went through the physiology related to the cardiovascular system, how blood moves through here, how blood moves through the heart specifically and the lung tissue. But the major thing that we did today was differentiate and understand left versus right heart failure, and then left versus right congestive heart failure. Remember, those are different. Heart failure is when the body's not meeting the demand. Right? When the heart is not meeting the demand, I should say. But congestive heart failure is when blood starts backing up because we're not meeting the demand. So those two words are different. All right. And so we've differentiated those, also looked at the signs and symptoms between right versus left congestive heart failure. All right. So take this, what you got today, and let's start applying it. Let's start reviewing it. Let's start looking for questions where we can take everything that we learned here and now apply it to the question and freaking crush it. That's what this is all about. It's an absolute pleasure to teach you. It is my goal to help you not just sit for the MPTE, to dominate it. If you got a lot from this lecture, can you put clear down? That's one of the words I use for my coaching students to let us all know that this concept was clear. You got it and you're ready to go out there and absolutely crush it. Sound good? All right, y'all. It's been a pleasure. Coach K out. As always, keep learning, stay committed. I'll see you on the next one.